Well, my name's Tony. Not that that is important. And you probably found this video because you, like me, were looking for some information about hernias, probably an inguinal hernia. What I'm going to do is tell you how mine occurred, what it is, although you probably already know that, and what happened to bring me to this point now, which is just after 3 weeks post-surgery. I had a general anaesthetic, open surgery, not keel, and I'll explain a little bit about that, how that came about, and also what I couldn't find on the internet, which is what I should be feeling, what are the side effects and those sorts of things, because I've learned a lot over the past 3 weeks, and I wish I'd known, not that I'd have changed anything, I would have still had this operation. I'm not a doctor, I'm not a professional. This is just a bloke from Yorkshire in England telling you how it is. So if you're in pain, discomfort, seek medical advice. And I hope that's enough of a disclosure on my abilities and also a bit of a don't do it yourself type of thing, seek professional advice. Also, I'm not getting paid for anything, and I'll tell you how it is. So if this is inappropriate, I do apologise because it's not meant to be. I'll try and use proper technical terms about the gentleman areas and things like that. But it's not for kids, but it's just for those people who'd like to know a little bit more, as I did. So, as I say, my name's Tony. I'm 60 years old. I got an inguinal hernia from lifting something far too heavy and sneezing. Thought, pop, what's that? And put the item down. And lo and behold, just in my groin, where your legs join your groin, your pelvic bone across the top, there was a lump. I pushed it back in, like most men, thought it'll go away. It didn't. Did some investigation, inguinal hernia, and it's where your intestine pops through a little bit of your lining of your abdomen underneath the skin. You get a bit of a bulge. When you can push it back in, and it goes back together. But every time you move, it pops back out. Some people it doesn't hurt, some it does. I took the decision to have something done about it after a month or so because there can be risks of strangulation, and it did ache. It's a shooting pain down to my testicles and down my legs, and it was very uncomfortable. So yeah, that's it. 60 years old, as I say, quite fit and healthy. Before the hernia, could do 3K of running without stopping, 5K with multiple stops. Fit, healthy, digging, everything on no medication whatsoever. Resting heartbeat 60 something. Yeah, reasonably fit for my age. Like I said, don't believe in taking any tablets or pills unless I need it. They seem to be okay. Blood pressure normal. So touch wood. Apart from a bit of vitiligo, which is depigmentation of your skin, which goes white. Yeah, pretty okay, as I say. Superstitious. I touched some wood somewhere. So that's what it was. Went to the doctors, quick examination. Yes, we'll get you referred. Being in England and then NHS, I didn't hold my breath. It said it could be some time. About 12 weeks later, I got a phone call. I'd been referred to a private hospital paid for by the NHS. Asked me to come in for a referral examination, which I did do. A quick lower of the trousers, lower of the boxer shorts, keeping everything else under cover. Press cough. Yep, that's an inguinal hernia. We can do something with that. Brief discussion now. This whole examination took no more than 15 minutes, I would say. The surgeon I was speaking to said yes, he believed in not using keyhole but open surgery. So that's under anaesthetic, cut you open, took everything in, put a mesh there, stitch it all over, stitch your skin up. Happy days. He explained his preference. If I didn't like it, go back on the waiting list and go to somebody who does a laparoscopic, is it? Keyhole. Explained that with keyhole, the inflate with gas can be uncomfortable. With general, then general and open surgery is longer healing, but you end up with a bit more of a scar. I'm not bothered. Quite a hairy man in my 60s. I'm not going to go on Love Island or anything. Not too bothered. So yeah, went for that general anaesthetic, open surgery. All good. Happy days. Said they'd be in touch with an actual confirmed surgery day. That was it. About a week later, 2 weeks later, came to me with an appointment. Yep, not a problem. Needed to go in a week before for a pre-assessment, blood pressure, height, weight. Again, a little bit of an examination. Nothing that's embarrassing or anything like that. Took my blood pressure. Said it was 150 over 90, which is high. Don't know much about blood pressure. white coat syndrome. However, they recorded that as 180, and there was a follow-up phone call saying your blood pressure's too high, keep a diary, which I bought a little blood pressure monitor, and it was resting around about 120, 125 over 80, which is pretty normal apparently for my age. So no problem there. Also gave me something called a Hibby wash, and basically you shower with this stuff and it bonds to your skin and kills bacteria. Minor thing about that is it reacts to bleach. So if you bleach your shower, it goes bright orange. So just be careful with Hibby wash. It is in the instructions somewhere. Couldn't find it. Didn't know until too late, but it does come off eventually. Hibby wash, bleach, no. But the Hibby wash, really good. Cleans your body of bacteria and risks, lowers the risk of infection and bonds your skin, etc. And you use that right up until the morning of your operation, and you shower on the morning of the operation. And make sure you smell good, especially gentleman regions, if you know what I mean. You don't want anybody messing about down there and thinking, oof. So yeah, make sure you're clean and hygienic, etc. So that was it. Followed everything as I should do. What to take into hospital? I was told to take some pajamas, some slippers, some toiletries, and the dressing gown, maybe a phone with a charger just to keep yourself occupied. On the morning, extremely nervous, never had anything like this. And when I say fight or flight, I nearly did a runner. Just so terrified, never been unconscious or out of control, absolutely terrified. However, ask the question and tell the staff at the hospital. I was shown to a room, given some stockings, compression stockings, and a gown, told to put it on. Somebody had come in and take my blood pressure. Before I could do that, somebody did come in and take my blood pressure, and I just said, "How do I put these stockings on?" Never seen them. I think somewhere in the medical profession, they think that everybody knows how to put compression stockings on, so your toes hang out and they come up past your calf, and the gown goes on backwards and ties just in one or two places. Never done it before. So yeah, ask the questions if you're unsure. Paper pants, that's a new one. It's like paper knickers. They're miles too big. You can put your head through them and your body through them. All the openings are the same size. I asked the silly question which way around, and they laughed because everybody asks that. Paper pants on, gown on, compression stockings, and that's it. Apart from that, you're pretty naked, but you're covered up. And the staff are very, very respectful of your privacy and your dignity. So don't worry about that. Have a wee as often as you can. Leading up to this, a little minor thing that was told, drink plenty of water, no alcohol for 4 days, a week beforehand. Certainly don't do any drugs or anything. Don't stop your medications, what I was told. And then drink plenty of water for 48 hours to make sure they can find veins and things like that. And all that's paid dividends. So listen to what they're telling you, take the advice, don't cut corners. Nil by mouth, no food or chewing gum even for at least 6 hours before your operation. That stops you being sick and complications. I actually went about 8 or 9 hours just sipping water, make sure I didn't dehydrate. So that's it. So what happens? Surgeon comes in, big cross, make sure they're operating in the right place. Big crosses and arrows pointing to my right side. Now, something that people don't seem to know when I've watched videos about this on, especially on YouTube, is what an inguinal hernia is. Now, I've explained it, but basically, as a male, when I'm a fetus, there's two channels that go down your groin. And when you're a fetus, your testicles are in your tummy and they go down and drop out. Your balls drop, excuse the expression. But that leaves an opening, a canal, and it's a weak point in males, and hence, for some reason, particularly on the right, we get hernias for lifting. It's nothing to do with levels of fitness, it's just a strain, worn through, happens, can be repaired. So mine was mesh. As I say, a few stitches. There is other things, glue and what have you, but this was mine. So that's where we are. My time came. Surgeon came in, as I said, marked everything up. Anaesthetist came in and said, "We'll be taking you down in a minute." Went through, double checked or triple checked, no allergies or anything like that. I'm allergic to penicillin. Had a red band around my wrist to say that. Double checked that. Told him I was absolutely terrified. Explained again what was going to be happening. What took me down to the pre-theatre room. Don't know the technical term. Lovely theatre nurse there said, "You are very nervous, aren't you?" I said, "Absolutely." My hands were sweaty, yet I was cold. Before I knew it, I had a cannula in the back of my hand, didn't even feel it. They said, "We're just going to give you some gas to relax you." Didn't do anything, but hey ho, before I knew it, I was waking up in the recovery room and it took 40 minutes. They're literally pushing me through the door into the recovery room. Like, is that it? What time is it? And they were amazed I was awake so early. And then I immediately drank a lot of water. I was told that as well to flush all the drugs, stop you feeling sick, etc. And then literally 15 minutes after that, I was back in my bed, my room, and they was bringing me a cup of tea in Yorkshire tea and asking me if I wanted my sandwich or something to eat, which I did. And about 30 minutes after that, I pressed the buzzer because you're not allowed to get out of the bed because I needed a wee. I went and I had a wee, which was fantastic because they want to know that you've not got a lazy bladder. In other words, the anaesthetic and all the drugs they give you hasn't numbed your bladder so you don't know you need a wee to release it. So it's important that you do have a wee as soon as you feel able to, but don't get out of bed by yourself. They get somebody to help you. I stood up, said, fine, walked off, left me alone, had a wee, came back, got into bed. Then I had another one about an hour later. So my operation took place about 12:30, and at 3:30 p.m. the same day, I was back home. My wife picked me up, done and dusted. That's it. Plain straightforward, apart from the nerves. Now, the bit I want to explain here, and the bit I could not find online, is what happens afterwards. So I had a probably about 3-4 inch opening with stitches, dissolvable stitches inside and outside, and then a big sticky plaster type thing over the top. I could have a shower 24 hours after, as long as I don't get too wet, and then remove the dressing a week after. Okay. It was swollen, didn't particularly hurt. Gave me codeine and paracetamol. I only used about 4 codeine tablets for the first 2 days. A bit of discomfort, but that was about it. The following week, so 1 week after operation, it felt a bit strange, still a bit of numbness. And the key is here to lay pretty much immobilized. So try and keep your body pretty much like that, gentle walking. Follow the advice that they're given. You get a strange sensation in your groin. Now, what nobody told me was, as a man, you're still going to get an erection. And believe me, when you get an erection, you know about it. And I've since done some research, and all the tendons and fibers as you get an erection pull through this tunnel area in the groin area. And it's still a bit sore, shall we say? You've had the major operation and it feels uncomfortable. Now, I thought my gentleman parts weren't going to work again until I started researching it, saying it's normal. So didn't bother with any sexual contact, masturbation, or anything like that. Okay, just left it, and that's the thing to do. Okay, you can't stop yourself getting spontaneous erections. You can't stop yourself trying to roll over in the middle of the night, but you know about it. That's all I will say. It's not excruciating pain, but it's bloody uncomfortable. A week after that, I thought it might be okay. No, still can't masturbate. It hurts to get an erection. It's really aches. It's like being kicked in the nuts. Really does ache a lot. Not screaming pain, but aches. You don't want to do it. 2 weeks after that, it's still there. What's more, when you touch your penis, you get a prickly sensation. That's the way I can describe it, round the groin area and along the shaft, against all the nerve fibers knitting together and spontaneously giving off signals, which makes it feel prickly to yourself, a bit more uncomfortable. And here we are up to today. Masturbation, it's doable, but not that much enjoyable, particularly after orgasm. It's like everything's swollen and inside and knitting together, and blood's gone to places it hasn't gone to for a week. So, and it stretches things. Okay, so what I'm saying is it's all normal and it's starting to subside as we go into week 4. Okay, so don't worry about it. All these things are documented in the NICE guidelines. Your surgeon will answer these questions honestly if you ask the question. But in my case, and certainly online, you to do some digging about the penis and ejaculation and orgasms and erections. It is hidden away in there, but everybody will tell you the same thing. But it comes back to normal 4 weeks onwards. Okay, and that's about where I am now. Um, Wife can't wait. Echo. But that's it. As for scarring, very faint scar, probably as I say, 4 inches long, turned white, little bit of a raised ridge as the collagen comes together. I'm a hairy person, start growing back. No need to shave before you go in there. Do a good job of that. A big area. All that's sort of like coming back to normal. I can touch the wound. Dressing was off, as I say, after a week, showering. Pretty much okay. Gentle exercise, meaning gentle walking. Don't be lifting, don't be kneeling down. Even 4 weeks after, don't be kneeling down or picking big bags up. Sit-ups. Just take it careful for at least 4 to 6 weeks is what I was told. And I'm doing just that. So far, so good. I'll try and explain anything you might put as questions and stuff, but I can't guarantee it. I'm not a medical professional. Think about speaking to your doctor before raising me a question. Okay. I hope that makes sense. And sorry for the Northern England, Yorkshire dulcet tones, but just saying how it is. All right. Thanks a lot, everybody. Good luck if you're going through this procedure, but don't worry, especially medical staff. Absolutely fantastic. Okay.